Hello everyone, I'm Dr. Priyanka Walvekar, oculoplasty consultant at Narayana Netralaya. Today, let us address one of the most common concerns that many of us have, dark circles. So what are dark circles, why does it occur, and how can we treat it? So let us address each of this. Now what are dark circles? Dark circles are basically darkly pigmented skin of the eyelid. It is commonly seen below the surface of the eye over the eyelid skin. So now why does it occur? There is a most important genetic predisposition to this, especially amongst the Indian population because of excessive melanin production or melanin pigmentation that occurs on the surface of the skin. Since it is more darkly pigmented, there is a tendency for it to have a more prominent appearance. Now coming to other important causes of dark circles. Now dark circle basically occurs because of the direct correlation of the same with the thickness of the skin. So did you know that the eyelid skin is the thinnest in the body? Now because it is thin, there is no underlying fat beneath it, and hence it is actually the color of the muscle, which is known as the orbicularis muscle, that is very vascular, that is supplied by a lot of blood vessels, which gives it that purplish or darkly pigmented hue or color, and thus it has a more prominent appearance below the surface of the eye. Now why does it occur? In certain conditions where there is lack of sleep, what happens is the vascularity to these muscles increases, and therefore the blood vessels increase in the size or the diameter, and that is why the purplish hue or the pigmentation increases. Now secondly, it can also occur in certain darkly colored individuals, dark skinned individuals where the melanin production is high. Thirdly, it also appears more prominently in those who are tired or fatigued, giving the eye a more dull or a more unwell look. This happens especially when one is tired, where again the blood supply to the underlying vessel increases, again owing to lack of sleep, and therefore that is another contributory factor. Now apart from this, also hydration is a very important factor for maintaining healthy lower eyelid skin. So hydrating the body well also has a direct correlation with dark circles. So now let us go on to why and how we can treat it. So now I enlisted the causes saying lack of sleep, fatigability, lack of hydration as some of the reasons, and also genetic predisposition in certain dark-skinned individuals. So to treat all of this, the most important factor would be to get a good night's sleep. At least about 8 hours of sleep per day is recommended. Now other than that, hydration is a very important factor. So hydrating yourself at least about 6 to 7 glasses of water minimum per day is recommended, and also for individuals who are extremely busy, they can always place a timer on their phones, on their mobiles to remind themselves to consume water and keep themselves well hydrated. Now third and the most important or the most commonly sought after technique is cold compression. So the cold compression actually has a scientific reason behind this. When cold compression is given around the eyes, the vessels which are actually dilated constrict, that is, they reduce in their diameter, and thereby reducing the pigmentation or the purplish hue which is seen below the surface of the skin. So giving the cold packs or the age-old placing cold cucumbers over your eyes is a very good and a recommended technique to reduce dark circles. Now apart from this, there are also commercially available creams which can help to reduce dark circles, and out of this, so always use topical creams which are recommended by a dermatologist or by an oculoplasty surgeon. So these are some of the few tips that one can practice in order to reduce the under eye dark circles. Thank you.